Have you ever found yourself in an emergency situation with someone close to you suffering from high blood pressure, not knowing what to do? Knowing how to act in those moments can make all the difference. In today's video, I'm going to share some first aid tips for hypertension that you need to have at your fingertips. This information could save a life, whether it's yours or someone you love. Here, you'll learn simple and practical techniques that can help quickly lower blood pressure without relying on immediate medication. I'll walk you through the steps to take during a hypertensive crisis and the warning signs to watch out for. With these tips, you'll be better prepared to handle situations that can arise at any moment. If you or someone in your family struggles with high blood pressure, this video could be life-changing. Stick with me until the end and discover how to incorporate these techniques into your routine so you can feel more secure in an emergency. Hypertension, commonly known as high blood pressure, is a condition that affects millions of people worldwide and often presents no obvious symptom until a crisis occurs. Imagine having a ticking time bomb inside your body, working against you without any visible sign. That's the silent danger of hypertension. It can linger for years, quietly damaging your body until that critical moment arrives, and then it's essential to act quickly to prevent serious consequences. Understanding what hypertension is the first step to effectively and safely managing. During a hypertensive crisis, blood pressure can spike to dangerous levels, putting the heart, kidneys, and even the brain at immediate risk. It's a race against time, and knowing what's happening in the body during that moment can make the difference between quick relief and serious complication. Even though hypertension is common, few people truly grasp the severity of the issue. It's not just about high numbers on the blood pressure monitor. It's a ticking time bomb that needs to be diffused before it explodes. And when the crisis hits, the right response can be the only thing that prevents irreversible damage. Being prepared means having the power to protect yourself and your loved ones in the most unexpected moment. During a hypertensive crisis, the body sends out warning signals that many people either don't recognize or choose to ignore, such as a sudden, intense headache, a feeling of pressure in the chest, or blurred vision. These symptoms aren't just everyday occurrences. They're a red flag that something is dramatically wrong and that blood pressure is rising uncontrollably. Recognizing these signs is crucial, as every second counts when a crisis is underway. Feelings of dizziness, accompanied by nausea or even difficulty breathing, are other critical signs. Imagine the sensation of the world around you spinning, your senses starting to fail, and an inexplicable weight pressing down on your chest. These are indicators that the body is being overwhelmed. To make matters worse, confusion can also set in, leaving a person unable to make quick, rational decisions exactly when they're needed the most. Knowing the symptoms also means knowing how to act to calm the situation. Often these symptoms are mistaken for stress or fatigue, but when it comes to a hypertensive crisis, the risk is real and immediate. Therefore, being able to identify these signs can make the difference between taking action to save a life or wasting precious time when everything could change for the better. Staying calm is the first and most important step when someone is experiencing a hypertensive crisis. Anxiety and panic only make the situation worse, as they contribute to further increasing blood pressure. Ideally, you should help the person sit in a comfortable position, with their back supported and feet flat on the ground. This posture allows the body to stabilize and prevents additional strain on the heart. Breathing should be slow and deep, which helps relax the body and, consequently, lowers blood pressure. Another crucial action is to remove the person from external stimuli that could heighten stress, such as bright lights, loud noises, or excessive commotion nearby. Creating a calm and peaceful environment can be just as important as administering medication. If the person is having trouble breathing, opening windows to let in fresh air can help oxygenate the body better and provide a sense of relief. Small changes in the environment can make a significant difference in this critical moment. Teaching breathing techniques is also an excellent form of intervention. The person should be guided to take a deep breath in through their nose, count to 4, hold it for a few seconds, and then slowly exhale through their mouth. This type of breathing not only helps the person calm down, but also directly contributes to lowering blood pressure. These are simple techniques, but they can save lives when applied at the right time. If the person has a history of hypertension, they may already have medication prescribed for crises. In this case, it's essential to know where that medication is stored and to administer it as directed by a doctor. Medications like captopril or losartan can be used under guidance, but it's important to remember that self-medication can be extremely dangerous, so only give something if you're sure it's safe and the person is already accustomed to taking it. Sometimes, a person may be so frightened during a crisis that they forget to take their medication or don't know what to do. This is the moment to stay calm and remember that proper administration could mean the difference between a quick recovery and a worsening situation. It's crucial to check if the medication should be taken with water, and if possible, monitor the initial effects, which may take a few minutes to kick in. Patience and care at this moment are just as important as the medication itself. If the person doesn't have any medication available, you'll need to explore other options while waiting for medical help to arrive. Remember, never offer non-prescribed medication, as the risks of an adverse reaction are real and could turn a hypertensive crisis into something even more dangerous. It's best to keep the person calm, comfortably positioned, and follow the guidelines to naturally lower blood pressure until an emergency team arrives. Having a blood pressure monitor at home is one of the best ways to manage hypertension. Knowing how to use it correctly during a hypertensive crisis can be essential for understanding the severity of the situation and deciding on the next steps. If the person is conscious and not too agitated, ask them to sit comfortably and apply the cuff to their left arm, making sure it's snug but not too tight. A correct reading will provide important information for the next steps. A common mistake is trying to measure blood pressure multiple times in a row, which can lead to inaccurate readings and increased anxiety. Blood pressure should only be checked once or twice, with at least a few minutes between measurements. During a crisis, it's important to communicate the results to the doctor or emergency team so they can assess the situation and respond appropriately. Each reading tells a story about what's happening inside the body and how to proceed next. If the blood pressure reading shows an extremely high value, typically above 180 over 120 millimeters of mercury, it requires immediate attention. At that moment, the focus should be on reducing any stress factor and following medical instruction. Remember, a blood pressure monitor can be a powerful ally, but it doesn't replace the need to seek professional help. It's meant to provide critical information that can aid in decision-making until a doctor arrives on the scene. There are times during a hypertensive crisis when home remedies simply aren't enough. Recognizing when the situation is beyond control is vital for ensuring the person's safety. If the pressure is above 180 over 120 millimeters of mercury and doesn't decrease with initial care, it's time to call for medical help immediately. Additionally, if the person is experiencing severe symptoms, such as intense chest pain, difficulty breathing, or signs of a stroke, like sudden weakness on one side of the body, or difficulty speaking, emergency services should be contacted without hesitation. When calling emergency services, it's important to provide a clear and accurate description of the symptoms, the person's history, and the actions that have already been taken. This information can expedite care and help professionals understand what's happening even before they arrive on the scene. Don't downplay the symptom, even if the person insists that everything is fine. The fear of going to the hospital can be a barrier, but safety should always come first. Once medical help is on the way, it's crucial to keep monitoring the person and do your best to keep them calm until help arrives. This may mean continuing to talk in a soothing manner, assisting them with slow breathing, and ensuring they're in a comfortable position. Every action counts during those waiting minutes, and the focus should always be on keeping the person stable and safe until specialized professionals take over. In a hypertensive crisis, knowing what not to do is just as important as knowing what to do. Many people, in a moment of desperation, resort to dangerous methods to try to quickly lower blood pressure. Practices like intense exercise, taking very hot baths, or even trying to induce vomiting can be extremely harmful and may worsen the situation. The body is already under significant stress, and adding more stress factors can have serious consequences. Another common and dangerous behavior is self-medication. Often, in an attempt to help, Someone may suggest or offer a medication that hasn't been prescribed for that specific individual. This is extremely risky, as blood pressure medications have effects that can vary based on the person's health status. Administering the wrong medication can lead to complications such as a sudden drop in blood pressure, allergic reactions, or dangerous drug interaction. In this situation, it's always better not to take risks and only offer medication that have already been prescribed to the person in crisis. In addition, it's important to avoid discussions or situations that could increase emotional stress. During a hypertensive crisis, the environment should be as calm as possible. People around should avoid abrupt gestures or intense conversation, which can raise tension and make it harder to stabilize blood pressure. A calm, safe environment with emotional support is the best way to help someone get through a crisis without increasing the existing risk. Preventing hypertensive crises involves adopting healthy and consistent habits. Small changes in daily life can make a big difference in keeping blood pressure within appropriate levels. One of the key points is diet. Reducing sodium intake, avoiding ultra-processed foods, and including more fruits, vegetables, and potassium-rich foods can greatly help in controlling blood pressure. What many don't realize is that food choices directly impact heart health and blood vessel function. Besides diet, stress management is a vital part of prevention. Practices like meditation, yoga, or even hobbies that promote relaxation can be powerful tools for keeping blood pressure in check. The body responds to stress by raising blood pressure, so learning to manage these moments is essential for anyone living with hypertension. Finding ways to relax isn't just a choice for well-being, it's a necessity for ensuring cardiovascular health. Regular physical exercise also plays an important role in prevention. It's not about exhausting workouts, but rather moderate activities like daily walks, swimming, or cycling. Keeping the body active helps strengthen the heart, improve circulation, and naturally lower blood pressure. These practices not only prevent the onset of crises, but also enhance overall quality of life, providing more energy and reducing health risks. Now that you know all the essential measures for dealing with a hypertensive crisis, remember the importance of being prepared and maintaining healthy habits to prevent these situations. Knowing how to act during a crisis can not only save your life, but also the life of someone close to you. Hypertension is a serious issue, but with knowledge and practice, it's possible to drastically reduce the associated risk. If you found this information helpful, don't forget to give it a like and subscribe to the channel for more health and first aid tips. Share this video with friends and family so everyone can stay informed and prepared to act in emergency. Your actions can make all the difference. Our goal is to help as many people as possible be ready to handle critical situations like this. Leave a comment below if you have any questions or suggestions. We'd love to hear from you and make our content even more relevant and informative. Take care of your health and always be ready to help those in need.